Mizzou's fall semester starts in about 2 weeks, which means thousands of students are making their way to Columbia. So today I talked with MU Healthcare's Assistant Chief Medical Officer about how they're preparing for their arrival during a pandemic. So Dr. Wakefield, what can you tell me about how MU Healthcare is preparing for this upcoming fall semester?
So MU Healthcare is preparing for the influx of new students on campus by partnering with the campus as well as Boone County Health Department to develop strategies to test when appropriate symptomatic students, to trace exposures, and to provide guidance and care for our students and for our faculty and staff.
What, if anything, will change as far as testing when we have all these students come back?
So I don't think we're going to change our indications for testing, but we're adding more than 20,000 people potentially to our community. So we have to have the capacity to ensure that we're able to test as appropriate.
Will there be any additional testing locations on campus that MU Healthcare is providing?
I know that's been discussed, but has not been decided.
Does it concern you at all to add 20,000 people to the local population during a pandemic?
So it's not like we're creating 20,000 new people. They're somewhere, and they're involved in mitigating the risk of the pandemic in their hometowns. And education is critically important. So I think it's a thing that we can manage as long as the healthcare system has the capacity that it does. And our message of being safe, wearing a mask, maintaining social distancing, washing your hands is followed. I don't think it will present an unacceptable risk.
What can you tell me about the current hospital capacity going into the fall semester?
The hospital as a whole is doing reasonably well. We're at capacity, but it's not due to COVID. So we're busy. We have the capacity to take care of critically ill patients every day. We're not overwhelmed with patients with COVID at this time. That being said, we have contingency plans to adapt if there is a surge of patients in the future.
Dr. Wakefield, thank you so much for your time today.
My pleasure, thank you.
Dr. Wakefield and I also talked about whether outbreaks at MU will be made public, how much PPE they have on hand, and his message to parents with children coming to Mizzou. You'll be able to find all of those answers to those questions on our website, KOMU.com.